All right, everyone, let's get started. Again, thank you very much for the time. Thank you very much for joining me. It's great to see so many familiar names, some new ones as well. For those of you who I haven't had the chance to meet yet, my name is Bernardo Pinho. I am the VP of Sales of Liferaft. I have been hosting a few of these webinars. Our co-founder Nimish has been hosting a few others. The webinar we're hosting today, as was expressed in our broadcast email, is really to position Liferaft with a lower premium plan for your clients, and mathematically show you guys show you the financial impacts of actually doing so, and showing you that the cover is still there, depending on the kind of events. I prepared a presentation, so I'm going to go ahead and put that up. Now, you guys tell me if you guys can see it. Can you guys see my screen? Again, just a little raising of hands or, okay, perfect, perfect. I'm going to go ahead and put this in presentation mode. All right. So what we're going to do is I've prepared a pretty short presentation, and I want to leave some time at the end, first of all, for questions and a discussion. And then there's a surprise at the end for a lot of you and for our preferred agents. A lot of the agents on this webinar have been consistently on our webinars, and we appreciate that. And we do want to reward you for all of your engagement and being with us throughout this journey. So at the end, there's going to be a little bit of a surprise. And again, our goal is to always help our agents as much as possible in not only selling to your clients, but also creating the best kind of content and collateral that we can for you guys. So we're going to go ahead and jump right into it. What we're covering today basically is we're going to give you a very quick refresher on our hospital supplement plan. So you either have, a lot of you either haven't had the time to come back and review our product, or maybe you haven't gotten in front of your clients in the last couple of weeks, but we just wanted to give you a refresher. For many of you, or for some of you, this might be the first time that you've engaged with Liferaft since you've been appointed, because there are a lot of new agents coming in. So we just wanted to give you a quick refresher on our product, on the product details, and some of the case studies around our product as well, just to get you guys familiar with it just one more time leading into the webinar. And then I'm going to go over a little bit of the kind of outlook on healthcare cost pressures for 2021. Now, as a lot of you know, we've had an atypical year in 2019 and 2020. So a lot of analysts are expecting that to have an impact on healthcare costs going forward. And we've kind of collected some data, and we want to present to you guys what that's going to be looking like in the future, and how that's going to impact directly some of the premiums that a lot of your clients are probably going to feel on the readjustments during open enrollment. And then we want to show you some examples of how you can actually couple bronze plans with Liferaft and have the same, if not better, cover than you would on a silver plan. We know that a lot of times when it comes to open enrollment, when it comes to either renewing or buying healthcare, people always look at the downgrade of your metal status, and then look at the premium savings versus the benefits and the cover. And we kind of wanted to illustrate not only on a kind of average scenario, which we've done, but also on a specific plan to plan scenario. So we've done an average of a specific state. And we've also kind of delved deep and done an analysis on two specific plans, silver and bronze, and show the financial benefits of actually coupling Liferaft with coupling a bronze plan with Liferaft, excuse me. And then at the end, the surprise is basically us making dedicated sales materials for you. But I'm going to get into that right at the end. So I'll keep that a little bit of secret. That's a bit of a spoiler, but I want you guys to kind of know what we're talking about a little bit further in. I'm going to jump right into it. So I think a lot of you already know our philosophy in Liferaft. What we've tried to do, and what we're trying to do, consistently trying to do with our growth and with you guys, is basically creating the most simple supplemental healthcare products that we can. As you know, as agents, the supplemental healthcare space, I've heard of a lot of agents saying, I don't like selling supplementals because a lot of clients either feel cheated, they don't feel aligned to it, there's a lack of engagement, they don't really know what they're getting into. And we're always trying to make products which are very easy to understand getting in, and then very easy to understand, with the payout as well. We like the indemnity style of product because we feel like it's a very easy to understand product, very different to other products that are currently offered in the supplemental healthcare space. We are always trying to develop and to launch and roll out products with the same look and feel as our hospital indemnity plan. As many of you know, we're going to be rolling out in the next few months a critical illness product, which again will have a very similar look and feel to our hospital indemnity plan, which means that it's going to be a guaranteed issue product, and your clients are going to know exactly what to expect from Liferaft with the clients that we keep developing and rolling out. So this is our kind of North Star. We are always going to develop products which are simple, easy to use, simple to understand, and transparent. And we always want to create the most good faith between ourselves as a carrier, yourselves as an agent, and your clients. Clear value proposition to policyholders. They understand exactly what they're getting into. They are buying a product which they understand and which they need. And then we're also delivering value not only to the policyholders, but yourself as well. We understand that, as we said before, the sale of supplemental healthcare has always been a little bit frictional. Some clients, they think that the benefits of supplemental versus what they would get on a silver plan, if they were to get a bronze versus supplemental versus a silver plan, because of them not really understanding how the supplemental product works, that it wouldn't be worth their while. So we actually deliver that value both to the policyholder and to you as an agent who can actually sell it in a frictionless process with your clients. So again, our hospital supplement product, for those of you who probably haven't seen it in a while, is a straight cash indemnity product. It is basically on a cash indemnity benefit for accident or sicknesses. It is a guaranteed issue product, as all of you know. It is an individually filed product, which means there are no minimum enrollment requirements. And differing to other plans, we're going to get into the details in a little bit, but we've made it as affordable, transparent, and as easy to use as possible. Obviously this plan, working as an indemnity product, it basically helps defray your out-of-pocket expenses to meet any unforeseen costs. We know that with any kind of health plan, you're never going to meet your deductible or your max out-of-pocket with routine checkups, with labs, with imagery, whatever it is. It's probably going to happen with some sort of an unforeseen severe event, be it an accident or a sickness. And I think that's where most clients are exposed. And that's where you're going to exhaust your max out-of-pocket very quickly. So having a protection for that, and knowing that that is most likely going to be something which is going to probably end up warranting a hospitalization, is why we created this product in the first place. And it's very different to the products already offered in the market, as a lot of you already know. Being a straight cash indemnity product, I think people like it more because they understand exactly what they're going to be paid out. Whereas with other products, sometimes they're a little bit confused. A lot of other products basically pay out their either indemnities, or they pay out according to a specific accident chart or a sickness chart. And a lot of times you think that you might be getting a certain payout, but then when it comes time, you're actually going to get paid less than you thought. And then when it comes time to readjust your plan or renew your plan, your premiums spike, or then you're canceled, or whatever it is. It's just, we like to have a very specific set of nothing would gate you at the entry, but you know exactly what you're getting into. Your premiums don't readjust. You continue on the guaranteed issue and age-rated premiums after you've used the product. And we can get into the specifics here. So as I said before, guaranteed issue. And I kind of want to stress that this is true guaranteed issue. I think a lot of people on this call have heard the term guaranteed issue with other kind of supplemental or even health products. But it's never guaranteed issue if there's knockout questions, or if there's a specific question or specific tick that you put in, which either adjusts your premium or kicks you out of the process, right? So ours is actually true guaranteed issue, which means that we ask no medical underwriting questions and we have no knockout questions. And you know exactly what your price point is going to be depending on your plan and your age range and your age bracket. Um, so I think that kind of differentiates a little from the market. Famously, a lot of you probably heard of Philadelphia American, which is a plan which markets to having a guaranteed issue hospitalization plan. But then when you actually delve deep into it, you realize that it's only available for people who have a BMI index inferior to 27 or 26, if I'm not mistaken. So that's obviously not true guaranteed issue. One of the things that we've realized is that people who need the product are seldomly the ones who can actually get it. We wanted to change that. We wanted people to actually be able to have that peace of mind and be able to actually get the product if they need it. So our issue ages, as most of you know, is 18 to 60 years old. The last enrollment age is actually before your 61st birthday. But then you can actually carry that on to 65. So a lot of you might have Medicare aged clients. This actually acts as a very good product to get clients into Medicare. So if clients, for example, are either pre-retired or retired before the age of 60, they can actually enroll in this product and it can carry them up to 65. So it can bridge them and they can, it can bridge them with a very affordable product um, to kind of defray that out-of-pocket liability up to the Medicare age. As most of you know, there's 3 daily cash benefit options, which is the 200, 350, and the 500 a day, which all double during the ICU stays, if that's part of the hospitalization stay. Our payment process is end-to-end digital. Basically after the adjustment is made, which is usually done in 24 hours, your payment's processed in 24 hours as well, paid directly to the beneficiary. It's not done through any of your other healthcare operators, which is good because basically that means that there is no kind of settlement between any kind of billings that you have through any kind of network that you're in and your supplemental. It goes direct to the person and they can use it, whichever way they want. Usually in terms of a cash cycle, you actually sometimes receive your indemnity from Liferaft before you receive your bill. So there's no actual cash flow cycle gap. So that's something that our clients have reacted, our policyholders have reacted very well to. A few details on the product, just going over it again, which is probably important. There's no hold on accident, obviously. This 1 day basically is just the time it takes to issue our product. As everyone here knows, the enrollment process is very simple. We literally ask 4 questions, which is name, age, address, a telephone number, and then a form of payment, which can be credit card, debit card, bank transfer. And then when it's enrolled, basically it takes up to 24 hours to issue. At that point, it is valid for any kind of accident, obviously. There is a slight hold for a sickness period, and that's only to defray people from actually buying the product when they're sick. So there's a 30-day hold, which is very standard and simple. As a few of you know, there is a hold on pre-existing conditions. This is quite standard with a guaranteed issue product, but we have built in some flexibility in that. The case that we always use as an example is diabetes. So let's say, for example, someone is diabetic and they have been accompanied by a physician in getting routine care on a kind of routine basis. They've been getting their insulin shots either on a weekly, bi-weekly, monthly basis, or whatever it is, and they can prove that. If in that 12-month period they have had any kind of accident which has led to an hospitalization because of something that they haven't done in their routine. So, for example, if they've forgotten their insulin shots, if something has happened, then that would be included. There are some other, chronic pains, and for example, something that probably wouldn't be included in the 12-month hold would be chronic arthritis. That's something which is a pre-existing condition, which doesn't have a kind of routine care, but we can give you a list of the things that are included. There's a bit of wording on that. We can give it to you. But just for now, the standard would be a 12-month waiting period, which is fairly, standard for a guaranteed issue product. and especially one which um, doesn't have any kind of adjustments on a yearly basis, and it's set premiums, right? So minimum group participation, none. As we said before, it's an individually filed product, so you can actually apply to it individually or as a small group. There's no limitations there. And as we said before, the premiums are age rated. So getting into the kind of crux of what we're talking about here today, um, I'm not sure if everyone knows what medical inflation is, but medical inflation basically is the aggregated cost of medicine, be it um, clinics, hospitals, prescription drugs, doctors, lab results, everything together. A lot of national entities will actually create a medical inflation index. Now there are a few, but once you take an aggregate of all of them, and you use some of the key ones like Kaiser Family Foundation, which you may have heard of, and minimum medical index, for example, um, we came up with a rough projection of what healthcare costs will probably end up looking like in 2021. So what we can see here basically is over the last 5 years, healthcare costs have risen steadily at between 4.5% to 5% on a year-to-year basis. Now, on an average, both Kaiser Family Foundation and Millennium Medical expect there to be a health cost increase of about 5% in 2021. Now, there is a general consensus that it's going to go up, and some have projected it'll go up more. Kaiser Family Foundation believes there's going to be a lot of pent up demand for elective and for non emergency surgeries and whatever, other things that weren't kind of done during COVID phases. People were a little bit reluctant to go into hospitals or clinics or to go anywhere. So a lot of the usage actually didn't end up, rising as much. But with a lot of pent up demand, we're going to see a lot of influx of patients going in for more elective surgeries, which will push costs up. Now, on Kaiser Family Foundation, in a state to state kind of segregation, we've noticed that two states primarily have seen a significant rise in healthcare costs. New York saw a huge rise in healthcare costs. Texas was a little bit more mild on average on a plan to plan basis at about 6% in 2020. In Florida was around 5%. That's something which I can share with you after this call. I can show you the link in the presentation that we got this information from. But the general consensus is that the readjustments for next year will rise. Now, the Biden administration has said they're going to throw more subsidies into ACA, so we may see more subsidized premiums. However, the actual benchmarks and the limits of who actually qualify for these subsidies um, still is remaining unchanged. And there's still not a clear sign about how they're actually going to issue those subsidies. If it's going to be on a premium basis, if it's going to be actually to the health provider who's going to decrease decrease their deductibles and max out of pocket liabilities. We don't know exactly what it's going to look like, but what we do know is that healthcare is on the rise again, and people who do not have subsidies are going to be the ones basically paying the brunt of this rise. Um, so getting into that, we actually kind of outlined Florida as a specific state that we wanted to highlight. We have a lot of Florida agents, and we will be looking at others. But for now, we did kind of outline generally what we got, the data that we got through ACA in Florida, and we ran 3 estimates. So this is a Liferaft and ACA plans. We did the Miami-Dade case study. So basically, we took all of the ACA level data that we found, that we extracted from the health.gov website that we found. We kind of collected from multiple sources. And we realized that with Liferaft, if you pair Liferaft to a bronze plan, you actually get more benefits. And so we ran a little bit of a simulation here. So on a specific bronze plan, and these are actually averages. So we averaged out all of the bronze plans being offered in the Miami-Dade County area, all of these silver plans, and then we averaged out what deductibles and what max out of pockets looked like. And then we ran a scenario of what a hospital stay would look like under each of these plans. So on the bronze plans, I mean, basically this data above was taken from that list. And then we took an average inpatient hospitalization cost in Florida to be around $2,500, which again, we took from the Kaiser Family Foundation. Um, and then the information above, we actually kind of, so we showed it out here. So for example, a hospitalization stay would cost for 3 days, would cost $7,700 on both plans. If you're max out of pocket on, and obviously, your max out of pocket, or your copayment, whatever it is, you would exceed your max out of pocket with a 3-day hospital stay at $2,500 on both plans. So you would hit your max out of pocket, and if you were to have a bronze plan only, you would be paying your max out of pocket. If you were to have a silver plan only, you would also be paying your max out of pocket. However, if you were to have a bronze plan on your premium of $425, shall I say, as a 35-year-old, if you had a $500 a day Liferaft hospitalization plan, which would pay you $1,500 out for a 3-day hospital stay, then effectively you would be paying $437 or $438 rounding up, and your hospitalization cost with your payout would end up being $4,913. So you'd actually have a savings on the hospitalization cost, and you'd actually be saving on average about $65 a month on your monthly premium. Obviously, that being about $600 or $700 and something dollars on a yearly basis. And your hospital, obviously, your hospital say doesn't nullify. There's no limit on it, as you know. A lot of other indemnity plans, you can use it once a year and then it resets the other year. That's not what happened with ours. You basically keep using it until the policy termination, until the policy expires. So this is what we've done on an average basis. This is us taking all of the averages and showing you what a bronze and a silver look like, and then what a bronze and Liferaft premium look like together. And this is how you can actually present it to your clients, saying, listen, you can actually comfortably switch from a silver to a bronze plan while having Liferaft, still saving on your monthly premiums, and knowing that if you do hit your max out of pocket through a hospital stay, you will be covered and it'll actually end up being cheaper. So, this is kind of like the outline that we wanted to show you. And I actually did it on a specific case for an older individual with similar premiums. And I wanted to show, we actually saw that one of the best selling, so through a platform called eHealth, we actually noticed that some of the best selling ACA plans in the Miami area, in the Florida area actually, but mostly in Miami, were actually Molina Health. So we did a Molina Bronze plus Liferaft scenario, and we saw that the savings were pretty significant. So we took Molina Core Care Bronze 2. I'm not sure if this is a plan that any of you have worked with before, but it's by far one of the best-selling bronze plans in Florida. We took a 45-year-old man and we saw what his premiums would be like and what the kind of plan looks like. So on the Core Care 2 plan, he has a max out of pocket of $8,550. He has on the Constant Care Silver plan a max out of pocket of $7,450. Again, on hospital stay, they pay 50% after the deductible is hit. And if you have a hospitalization stay of 3 days, again, with the Kaiser Family Foundation estimate of $2,500, it will actually cost you on the bronze plan $7,743. On the silver plan, you hit your max out of pocket and then so the cost of it on the left, as you can see here, would be 7,743. With the Liferaft plan, which pays you $50 a day, you would $500 a day, you would get 1,500 out. Excuse me. You would get 1,500 out, which would be a total of 6,243. And you would still be saving 152 from this. This would be the premium you'd be paying. Obviously, you'd be paying $25 a month for your premium plan at the age of 45, which would pay you $500 a day. So you'd still be paying, you still be saving $152 a month, which would be over 16, about $1,680 a year, switching from the silver to the bronze plan. And as you can see, you're still saving on the cost of hospitalization. Now, as you can see, the hospitalization obviously isn't cheap on a 3-day period, but it's still better than you would be on the silver plan. Now, these are obviously high level. These are very simple. This is just kind of like illustrating what it would look like and what the savings could look like. But these are obviously plans which we've used either on an average basis or plans that we've noticed are big sellers. Now, what we've wanted to do to you now going forward, to the brokers that we have on this call, is our entire philosophy is geared towards your success, because ultimately that's our success. So we know that sales material for you is key to engaging your clients and to selling. So what we want to do basically is offer you customized and tailored documents that you can actually present to your clients. And we want to couple it with the plans that you actually sell. So, you know, the surprise at the end of this basically is that we want to offer you sales materials and collateral that we're going to make, and it's going to have the look and feel of your agency and your name. But we're actually going to showcase what we've illustrated here today on the specific plans that you're selling. Now, all we need is a little bit of information from you to do that. So we just basically need, what are the top 2 or 3 plans that you're currently selling? What are the most relevant plans that you're selling to your client base, either during open enrollment or during the private private placement or off marketplace? How many plans do you sell more or less a year? What are the premiums? And are there any subsidies in terms of, are your clients subsidized or not? Just so we kind of understand what it's going to look like. But ultimately, what we're going to do is we're going to create a more detailed version of what we've presented, and give you sales collateral and marketing materials, which you can actually present to your clients when it comes time to either switching plans or when it comes time to renegotiating their plans. They can actually see it on paper and know exactly what it looks like. So we can bundle it together and show them the financial implications and the financial savings of using Liferaft with the bronze plan, as opposed to either just a bronze plan or a silver plan, which is more expensive. So I'm going to go ahead and stop here. This has been a lot of information. I've been talking nonstop for the last maybe 25, 30 minutes. I'm going to open it up now to any questions. I am extremely excited for this because I think that, we are constantly trying to help you as much as possible. Our big focus is to give you exactly the kind of tools, information, and materials that you guys need. So that's enough for me. I'm going to open it up to you guys. And as always, please go ahead and raise your hand, and I will open up your microphone so you can speak. So, all right, Vic. Okay, I think Vicky was the first. Hi, Vicky. Vicky, I think you're on mute. I'm not sure if you raise your hand to ask a question, or I'm not sure if you. Hi, Vicky. I still can't hear you.
Can you hear me now?
Yeah, I can hear perfectly.
Yeah, that was just whenever you had first asked the first question. No, I'm just excited. I've been asking for this for a while, so I'm really excited about this material, getting it in hand.
Perfect. So Vicky, after this call, I'm going to go ahead and, this is for everyone. I'm going to go ahead and basically shoot everyone an email individually, and then request the information that I asked for in the presentation. And then we'll start making those materials over the next few weeks, and we'll give it back to you. Not only are we going to give you digital information but we're also going to print it out for you and send it to you, send you actual physical documents on nice stationery, so you can actually present it to your clients in person as well. So I appreciate that.
Awesome.
Vicky. Thank you for that.
Sure.
Let me go ahead and open it to Mr. Bill Wiki, who is always very keen. Mr. Wilkie, sorry, how are you doing?
I'm doing well, thank you. Had a quick question. Out of do we have an average, like out of 100 people that have health insurance, how many will stay in the hospital for 3 days or more? Is there like a
We
national average or something?
we do we saw that number. So in the Kaiser Family Foundation report, we do have a percentage of Americans who are hospitalized and the average number of days hospitalized. The average number of days for an inpatient hospital stay is actually 5 days. So that information I already know, but we will get you that information. And more importantly, people who are actually considered inpatient hospital stays. It's a number which is actually larger than people would think. So we will definitely get you that information. I appreciate the question, Bill.
Okay, thanks.
So Calbert had a question here. I think, let me see this. So Calbert's asking if you don't actually sell any ACA plans, you thought we can, but are they not ACA or do you sell other health plans? We can actually still offer other materials if it's coupled to a specific product sale, but we find it works best because obviously our products work best when it comes to either an ACA or an actual health, health insurance policy. It's just an easier kind of sell together into couple. For example, life or final expense. We can offer obviously sales collateral and we can work on that, but probably doesn't have the same kind of significance to a client to actually couple it together and to show the financial implications of having a specific life policy and a health supplement policy. But we will definitely look into that, and I appreciate the question, Calbert. I think we have. Is Bill? Did you ask another question, or is that? I'm going to go ahead and let you talk again. Is that another question, Bill, or is that your hand just up again?
No, let me just take it off.
Okay, thank you. All right, any more questions? Really appreciate everyone's time. Anything else? I mean, if you guys want to type it into the chat, So Yolanda, the presentation with prospects, yes, we can actually make a presentation similar to this webinar, which is more general, but it would be better if following this call, I'm going to be sending you an email requesting some of the plans that you're selling. We find it's probably easier and more directed and targeted. It'll probably be better for you as well. So we do have a presentation on Liferaft and on our product, but specifically for this purpose of actually coupling it with an ACA Bronze, Silver, or another metal plan, it's probably better if we engage more directly and target to your client base. So thank you for the question. Anyone else? Any other questions? Really appreciate your time, everyone. Oh, another question here. Oh, that's Yolanda. Thank you very much. Anything else? Anyone else want to speak? Anyone else want to ask any final questions? Anyone else want to? Okay, if no one else has any questions, no one else wants to say anything else in the chat room. Oh, hold on. Okay, thank you from Vicky. Well, listen, thank you everyone for attending. We have really enjoyed putting together these webinars. We are going to continue with our webinar series. We hope you found it useful. Again, always give us feedback on what you've thought about our webinars. Always give us feedback on things that you'd like to see. If there's anything which you'd like to see in these webinars, we love getting feedback from you directly. send me an email, send me a message. There's another question. Okay, Rigo, thank you very much. So yeah, the most important part of this is our agent network, and we are always trying to tailor and customize all the content that we provide to be exactly what you're looking for. So, Vicky, thank you very much for your feedback. Everything that we hear from you, we react to and we create. So always give us constant feedback, either through the support channel, through emails, through messages, whatever it is. So thank you again. Thank you very much for your time. You guys have a great afternoon. We will be putting this webinar onto the broker portal in a few days. So look out for that as well. And again, really appreciate your time. Thank you very much and have a great afternoon.